and welcome to part 4 of our Anxiety 101 mini-series. We are Vicki and Ashley from the Toronto District School Board Psychology Department. In this webinar, we'll be talking about some of the things that kids and teens might be experiencing during this time of COVID and physical distancing. We'll also talk about a few ideas that you might use to help your children cope. So what have some kids and teens been experiencing over the last few weeks and months? I want to start by acknowledging that there really is a wide range in how young people, and adults too, are responding. Some children and youth are enjoying what they see as the positives of the situation. So this might mean enjoying more time at home. Some might feel relieved about not having to go to school or other places that they might find stressful. Maybe it means, enjoying not having to rush from one place to the next. And some kids might find it easier to do schoolwork at home. They might be enjoying the greater flexibility or a chance to sleep in sometimes. On the other hand, there's lots of kids and teens who are having difficulties. So some may have concerns about the health and well-being of themselves or their loved ones. They might be having difficulty with uncertainty about when things will be open. And this is particularly true for things like schools, camps, parks, daycare. They might be struggling to adjust to and engage with remote learning, particularly as time goes on. And they may have difficulty with changes in routines, and that might mean you're seeing, more tantrums, big feelings, big behaviors from little kids. Teens in particular might be struggling with not seeing their friends, and big milestones like prom and graduation looking a lot different than they had envisioned. Again, I want to go back to the idea of variability. So you might be seeing shifts between different responses over time. Maybe there's some, confusion about everything that's going on. Maybe there's some time spent enjoying the novelty and not having to rush. But then there might also be some boredom because all days feel the same. And these changes might be happening moment to moment or week to week. So your household morale and mood might be all over the place. So for example, we're recording this during week 10 of physical distancing, and we've just learned that schools will be closed for the remainder of the school year. And it seems like a good number of people are experiencing what some have been calling COVID fatigue, where they're feeling a little bit tired of all this. So what are some of the things that you can do to help cope with these unusual times? First, we want to invite you to be gentle with yourself, and this is both true for yourselves as well as your children. Feeling strong emotions right now is a normal reaction to a really abnormal event. And it's okay to feel worried, frustrated, disappointed, bored. Many people are. Whatever you're feeling is really understandable. At the same time, too much worry can impact our well-being, so we want to use strategies to recognize and respond when worries are getting too big. We also want to acknowledge that productivity, motivation, attention spans are lower for some people right now. Sleep routines and screen time limits might feel out of whack and not where you want them to be. You're definitely not alone if these things are happening in your home. We also want to invite you to be mindful of social comparison. So social media is wonderful in that it can keep us connected, but right now it also might be filled with examples of caregivers who are cooking delicious meals and making, multicolor coded schedules for their kids. And your inner critic might be telling you that you should be doing all these things. And that's definitely not everyone, and it's okay if that's not where you are right now. We're all doing the best we can, and that looks different for different people. Another thing that might be helpful is to listen and discuss the worries that children and teens might be having right now. So let them ask about what they want to know and talk about what their feelings and worries are. You can pull on other strategies we've talked about in the Anxiety 101 webinars. So for example, part 2 has more information about how to talk to kids about their worries. During these conversations, it's important to provide honest but age-appropriate information about the virus. And this is particularly true for kiddos who are worriers. It might be necessary to address any misunderstandings or worst-case scenario predictions that they have about the virus. So for example, we know that young children sometimes have trouble understanding the bigger picture. So hearing about death on the news may make them seriously worried that they're very likely to die. And it's helpful to reassure your child about the facts that we know about the virus so far. So very few children are getting sick. You might explain to them that because of all the precautions your family is taking to stay safe, that they're unlikely to catch it. And just provide them some information so that they can put the information they're hearing on the news in context. It can also be helpful to address any worries they have about your family situation in an age-appropriate way. So we want to recognize that lots of caregivers have lots of stress on their plates right now. We just want to be a little bit mindful about how much information little ears are hearing about adult difficulties. We also want to say that conversations are important to have so that kids can process their feelings and their understanding of this new and unusual situation. But we don't want it to be the only topic of conversation for families. So we invite you to be mindful of how much time you're spending discussing COVID. We also want to talk about managing uncertainty or things you don't know. So during COVID, there's lots of uncertainty and things that we don't know about the situation. And this can be challenging for everybody. And it can be especially challenging for kiddos who worry a little bit more than others. So these kids often want to know what's going to happen next, and they feel safer when we have a sense of control. So it's okay if there's questions that you can't answer. So for example, children might be asking, will there be a vaccine? When can I play on the playground with my friends? When will we be able to have parties again? And given how much uncertainty there is, not only among ourselves, but even among the medical population, sometimes you're going to have to say that you don't know. At these times, it might be helpful to validate your children's feelings. Uncertainty and not knowing the answer to certain questions might make them feel confused, helpless, discombobulated, overwhelmed. So saying something like, I get that you miss your friends and it makes sense to be frustrated that you don't know when you're going to see them, might help them feel understood. It might also be helpful to recognize and acknowledge the truths about the situation, even when they're difficult or unsatisfying. So for example, there's things we can control and things we can't. There's things that we don't know and things that are uncertain about the future. And to recognize the challenging aspects and emotions associated with this situation.
It is safe to say that COVID has dominated almost all news and media outlets. While it is helpful to be informed, it can be easy to become consumed with COVID news, which can increase our levels of anxiety about our current situation. While we don't want to stop children from reading or watching the news, we do want to set some helpful limits around how much and what news they consume. Here are some tips to help support this balance. First, ensure time spent on news or media sources is limited and age-appropriate for children. This may involve implementing an information diet, where there is a decided amount of time that children or teens can spend on media outlets. A lot of media focuses on threat, uncertainty, and fear, which can fuel anxiety. By limiting our exposure to these outlets, we can help to manage our emotions around these topics. It's also important to be aware of the sources you are tuning into, as some sources may focus on the threat and fear, while others focus on factual, evidence-based information. You can model finding good health information online. So for example, if a child has a question, you may want to show them where and how to find credible sources like Toronto Public Health or the World Health Organization, and how to make sense of the information. This is a good life skill to have in general, even beyond COVID. You can also talk to children about how some stories about COVID on the internet and social media may be based on rumors and inaccurate information and are simply not true. This will help to build a healthy level of critical thinking skills around media or media sources. Finally, we want to be aware of the pros and cons of social media. While it can be a great way to remain connected to our friends and family, it can also be a source of anxiety if conversations are constantly about the threats of COVID and or how people are managing during these times. For example, there's typically a lot of social comparison that happens on social media, and now is no different. Be aware of how seeing activities that others are engaging in is affecting you, and as well be mindful about the impact of our own online presence on others. Because a sense of control is so important to our health and well-being, our minds tend to go to great lengths to gain control in the face of uncertainty. This can be challenging as there is often a lot beyond our control, especially now. Through highlighting activities that are within our control, as well as those that are beyond our control, we can begin to shift our attention and our efforts to things that we have a say over, like following guidelines set out by public health or practicing good hand hygiene and physical distancing, which can lead us to feel a greater sense of calm. As you may have noticed, amidst juggling work or school or family and friends, among other things, taking care of yourself may feel harder to do than ever. What we know about worry is that doing activities to take care of ourselves can be super helpful in managing difficult times. Many of the self-care practices will be similar to what you know or may already be doing, like engaging in healthy habits, eating, exercise, highlighting some healthy distractions to shift you in the moment, connecting with friends and loved ones, trying to have some routines and predictability. However, the how we go about doing this may require some creativity and thinking outside the box. It may also involve some trial and error. Further, these routines may have to change as time goes on, perhaps as weather changes or as guidelines change, or if you just need some variety in your day-to-day activities. You may like connections with friends or cousins via video chat, but find that the only thing they talk about is COVID. It is helpful to be mindful of that and find ways to adapt so that you can still connect with others while also taking care of yourself. You may, for example, suggest doing something together online, like coloring pictures or playing Lego and showing each other your creations, or playing online card games like Uno, or trying out a recipe with a friend. These can be helpful ways to connect around things that you love to do. Another strategy is recognizing the positives. Our brains have a way of focusing on the negative or worrisome information, especially for those who worry a lot. Thinking about the positives, the silver lining, and things we are thankful for allows our brains to practice thinking about positive things. This can be hard to do in difficult or distressing times, and it is worth mentioning that this practice doesn't take away our difficulties, but instead allows some attention to the positive aspects of our lives that may get buried beneath the worries. Some positives worth celebrating in our current situation are doctors and scientists helping people and studying the virus to help understand more about how to keep people safe. Canadians and people around the world are staying home as much as possible to keep themselves and other people healthy. There are many acts of kindness and generosity in the community. For example, people clapping at the same time every night for frontline workers, or kids writing chalk messages on the pavement and posting signs within their windows within their own communities. It's also helpful to focus on the coping strategies that you've been trying out and that have been helpful. This will ultimately help them to become more automatic. And finally, starting a gratitude practice can be another way to train our brain to focus on the positives. Gratitude can be thought of as stopping to notice, appreciate, and be thankful for the good things in our lives. We can be grateful for all kinds of people, things, and experiences. Maybe it's something we have, something someone has done for us, or something we have seen or heard. It can even be small, maybe even just noticing the leaves growing outside, or a song on the radio that reminds us of a nice memory. Starting a gratitude journal can be a daily or weekly activity that can help us focus this practice. When you write down a list of 3 good things that happened that day, you're asking your brain to scan the last 24 hours to find the positives. Over time, these practices can train your brain to be more skilled at noticing and focusing on positive things.
These are some ways you can get more information to help your children and teens. There's a number of websites that have put together helpful information about anxiety and mental health during COVID and physical distancing. A few of these are Anxiety Canada, the Toronto District School Board Mental Health and Wellbeing During COVID-19 Resources, School Mental Health Ontario, and jack.org, which has a partnership with Kids Help Phone. The What's Up Walk-In Clinic is offering free counseling sessions by phone or video Monday to Friday from 9 until 7. And you can call that phone number to make an appointment. Kids Help Phone is available 24/7 by phone or text. And you could also try watching parts 2 and 3 of this webinar series for more strategies to help children and teens cope with worry. Thanks for listening.